there to do this presentation, also demo something and to make them to know more about acupuncture, martial arts, maybe a little bit of herbal thing, medicine.
Sure.
So because you are the master of martial arts and you are the acupuncturist and a herbalist. So I told them you are so knowledgeable and skillful for this field.
Setting the expectation really high here.
Okay.
So I'm actually, is it possible to use the whiteboard?
Yes, we
Yeah.
can just,
Lift it up. Yep. I'll let you figure it out. 'Cause
Yeah, I will get it for you. I will be your assistant.
So basically, I brought acupuncture needles and cotton swabs so that we can spend most of our time actually putting needles in people. Because I figure you want to try it and experience acupuncture firsthand. Somebody's like, oh my gosh, no, I don't want to see that. But it's actually not that bad at all. If we have volunteers, and specifically if you have some sort of issue like back pain or neck pain, we can show you how this will work like immediately. And the other thing is, because I know exams are coming up, we're going to do things that can help with concentration and focus. Anyway, Chinese medicine, has anyone had acupuncture before? I see one hand. He was the one who was smiling the whole time. Yeah, acupuncture is bad. But very few have actually had acupuncture. So Chinese medicine is actually maybe 4, 5, 6,000 years old, but it really started to be codified about 2,000 years ago with the first classic text. Now, the first book was called The Yellow Emperor's Classic, and there was this idea that there was this mythical yellow emperor, and he was having a discussion with this Taoist sage. And the yellow emperor said, at one time, humans used to live, excuse me, let me turn that down, 500 years old and used to be healthy until old age. So why don't they live that way now? To which the Taoist sage said, humans have forgotten how to live in harmony with nature. And so that is sort of the basis of Chinese medicine, this idea that humans have forgotten how to live in harmony with nature. And so through that first text, you got the concept of yin and yang. We also say 5 elements, and I'll draw this all out for you so you can get an idea of what it looks like. Is everyone familiar with the idea of yin and yang? Yeah, everyone, you see it in our culture, you get cool tattoos and stuff like that. I put it on my arm. I don't know where your tattoo is. Yin and yang, basically, I will talk a little bit about this. Oftentimes in the Western thought, you see it as being opposites, but actually we see them as being self-generating and also working with each other to create each other and destroy each other and to oppose each other. So they're not necessarily, they are opposites, but they're more than that. And we look at the relationship kind of like a candle. The nature of yin we think of as being cool and nourishing, and yang as being hot and energetic. And did we say we had?
Yeah, yeah.
Oh, I see them. You only had black, huh?
Oh, you need a
color. It's okay. We'll make do with black. So we think of the relationship as kind of being like a candle, that the yin aspect is the wax, because it's cool, nourishing, substantial, and yang is being the flame. And we think the relationship between the two, if you have too much flame, it's going to burn the wax down too quickly. And if you have too much wax, maybe the flame will never get started. Or if you don't have a lot of wax, it can't support the flame for very long. So within our body, there are aspects that we say yin and yang. So that is one of the main concepts of Chinese medicine. Another concept is what we call 5 elements, or actually it's not exactly, they call it elements in Western thought, but generally speaking we would say it's 5 phases. And so the first idea of, actually it's not like the Avatar, never mind, the concept of fire, actually they use the Greek 4 elements in Avatar, which was kind of disappointed me. But fire, we think fire burns down to ash, which is earth. And out of earth, you can dig out metal. There's a test on this, by the way. I'm joking. I don't know if there's a test or not. Metal, we say, generates water, which has to do, well, keep on just going over this. And water, we say, nourishes wood. I have horrible handwriting. And then wood, we say, generates fire. So we have what we say is a cycle of creation. We say water douses fire, so a cycle of control. Fire tempers metal. Metal prunes wood. The roots of wood hold earth in place. And the shape of the earth controls the flow of water. So we have what we say is a cycle of creation and a cycle of control. If I had different colored markers, I would have put that in different colors. But we think that each individual element, each phase actually relates to a certain organ in the body. So we say the fire relates to the heart. And then the earth relates to digestion. We say the spleen and stomach. I won't write stomach. Metal we relate to the lungs. And water we relate to the kidneys. And wood we relate to the liver. Did I already use liver? No, I did not. Good. So all these aspects, we look at this in terms of the interrelations of how organs interact with the body. And it actually somewhat corresponds with what happens in Western medicine as well. Not 100%, but it's a fairly similar overlap. So this is the ideas that were coming out like 2,000 some years ago. Does anyone have any questions? Please ask questions. Oh, she's just scratching her head.
Sorry.
That's okay. I'm getting excited because I'm much better at answering questions than I am at presenting material, actually. Oh, good question.
Is there any particular reason how they, or is there any particular method that they use to determine which ones, like which organs went with which element?
In terms of originally, they looked at the nature of each element. So we thought of fire as being like creativity, motivation, and spark. And if you look at how, like even in the Greek understanding of elements, we thought of the mind as being centered in the heart. And so they thought heart must be related to fire. And the nature of wood, for example, if you look at a plant, the roots spread out and then the branches spread out. And so they looked at it as being functions of dispersing, and that's pretty much what the liver does. Saying that you're old enough to have alcohol, you drink alcohol and not get too drunk, that's usually a sign you have a pretty good liver. So we relate that to the functions of the wood. So they looked at the nature of each element and looked at functions in the body and correlated them that way. That's a good question. Any other good questions? Or bad questions for that matter? No? I'm going to keep on talking here until you get a question. So anyway, diagnostically speaking, if someone were to come in and say, oh, I have a headache, then we would start asking them questions like, do your headaches come with stress? Do they come with like a change in temperature or weather? And we would relate that to this model of the body. Or is there yin and yang imbalance? So for example, if they get a headache and their face turns red, we'd say, oh, that must be yang in nature because it's hot. Or if they turn very, very pale, we would say that might be more yin in nature of a headache. And then we could tie it into this system as well. Like if they have a lot of stress, I was saying how the liver or the wood aspect of the body is dispersion. Then if their headache is worse with stress, then we'd say they might have what we say is a liver stagnation. If that comes with insomnia, we might relate that to having extra fire in the body. So that's sort of the basic understanding of Chinese medicine. And with that, when someone comes in with some kind of imbalance, we'll use acupuncture needles, we'll use herbal medicine. Sometimes a lot of it's actually dietary. One of the main ideas with Chinese medicine is eating within season. So for example, generally speaking, in winter, before refrigeration and transportation, you couldn't get a strawberry in the middle of winter. So our bodies wouldn't necessarily handle strawberries better in the winter as opposed to the spring and summer. So oftentimes we say dietarily, what kind of dietary adjustments can you make? So, any questions, please? That's basically what I was going to talk about with Chinese medicine and hope that you guys would fill in with questions. Are you guys ready to try it? Anyone want to try getting a needle put in them? Yeah, okay, now the hands come up. Does anyone have back pain? Who has back pain? And are you willing to have a needle?
Yeah.
Okay, well, both of you have back pain?
Yeah. I mean, like, she can go. She doesn't have.
We'll get both of you, so you can, and everyone can come a little closer if you want to see this. Yeah, come on up. So there are other aspects of Chinese medicine. So we say when we talk about the 5 elements, we also talk about meridians in the body. So there's this idea that qi, or the energy of the body, moves along lines of energy. And so when, for example, where is your back pain?
This one's fine right here.
Okay, do you have upper back pain or lower back pain?
Lower.
Lower's a little easier, so we'll do lower first and I'll get you next.
Okay.
Where is your pain?
It's just like right in the
I'll turn
back
around and
here.
show everybody. You're okay sharing your history with everybody?
This is my back.
This is your back. Yeah.
Right here.
We're not going to talk tattoos, the hair.
Yeah.
All right, so right in this general area.
Yeah.
So let's turn around this way. So we call this the Du meridian, which has to do, we say the controlling meridian. And then we also have what's called the bladder meridian. So this is along the bladder meridian. And so we would treat this by going to the opposite side and saying what matches with the bladder from a Chinese medicine point of view. And we say that would be the lung. And it's kind of a long explanation. I won't try to explain it now. So what I'm going to do here, you can turn around this way.
Okay.
All right. And what causes pain? Like turning, twisting, bending? What's your name, bud?
I'm Nadia.
Nadia. I'm about to stick a needle in Nadia without even knowing your name.
No, it's okay. I mean, it's like kind of all of that. Sometimes I sprained my right ankle, so I feel like my back's trying to compensate for that.
How long ago was the sprain?
2 weeks ago.
2 weeks ago?
Yeah.
Okay. So is this the back pain recent, or has it been exacerbated by the ankle pain? Okay, because these are all the questions we will usually ask. So what I'm going to do, this is the large intestine meridian, and where she's pressing it is down near her hips. And what I do is I visualize this as being her belly button. And that is, if this was her trunk, this is her belly button. Or in that case, if you ran around to the back, this is the middle of the back. And so I would go press around here, getting any tenderness right in there? Yeah, right in there. Okay, so. You nervous? Have you had acupuncture? You said, oh, you're the only one who's had acupuncture. Notice he didn't volunteer at all. He's like, no. Okay. Come over here. So we're gonna use an alcohol swab. And then alcohol in my hands a little bit.
I want to get a picture. Oh my god.
Oh, we'll have time for selfies and everything later. Okay. So now this is kind of interesting. Have people seen acupuncture needles before? You probably can't see it from here. But I'm using what's called a guide tube because this was created by a Japanese person. They originally used bamboo tubes because this guy was awful at insertion of needles. And so whenever he put a needle in, the patient would scream and yell. And in Japan, they do not like screaming and yelling. So he figured out how to use a bamboo tube. Now nowadays we use plastic. So let's find this spot again.
So screaming and yelling?
There's going to be no screaming and yelling. I already paid her enough so she won't scream and yell. Tenderness right in there?
Yeah.
Is that it? Okay, so here we go. Is that okay?
Yeah.
It's in.
Oh, cool.
So I'm going to put it deeper. All right, now try to move around and tell me where your back hurts right now.
Like walk or just
Walk,
like
bend over, jumping jacks.
Can I see?
Yeah. It's still where it was before.
It has not moved? I didn't pay her
Oh
enough.
my gosh.
What?
Wow, it's funny because I actually feel it now. Like,
Feel the pain?
more, yeah.
She wants me to pay her extra. Okay, so here we are. Any tenderness in there?
No, not really.
Okay. Usually people are telling me, oh my God, it feels better. How about there? There?
Yeah.
Or there?
More here.
More off to the side. Okay, gonna go here. Sorry. Try to move again.
That's good. Oh yeah. Okay.
Is it hurting more?
No. I
Is
don't. It like.
Oh, relax your arm too, by the way.
Oh, okay.
All right, so right now, where are you feeling it?
I mean, it's less now.
Okay. So if it's less, but it's still there, it means that we actually haven't hit the spot exactly.
Oh.
Are you, that's right. We don't
No,
have
I'm
to do
good.
anymore.
I'm good, man. You can keep going.
All right. Yay. All right. So here we are. Go press. How about in there? It's okay. Nothing tender.
No.
There.
Yeah.
Okay. And last one. And hopefully this will take care of it. All right. Try again.
Yeah.
Okay.
I mean, yeah.
Wait.
Yes, I'll give you the check later.
Yeah.
All right. You can go ahead and take a seat in the front and have pictures taken or
All right.
whatever.
Oh,
Just
wait.
leave them in there. Oh,
Come here.
All right.
I gotta get Snapchat, you know. This is
Instagram
cool.
that.
So
I actually
instead
had
of-
somebody, she says she was a Snapchat celebrity. I had a patient, she came in, she was a high school girl, and she is a Snapchat celebrity, and her mom was there. She had her mom take all these pictures of her with needles. It was so funny. Anyway, so you have middle back.
Yeah.
Are you still up for this, even after she
Yeah.
screamed and yelled? Yeah, I don't know
It's
about
not
that.
bad at all, actually.
Okay.
What's your name?
Elise.
Elise. Okay.
Hi. Oh.
My
Sorry.
my hands are clean. Not anymore. So you're saying it's right about in there,
Like right, like here.
right up there.
Yeah.
Is that worse with stress?
I think I was like slept weird and I just like pinching and I can't.
Oh, it's
feel
just
it.
today.
No, it's been like a week.
It's been a week.
Yeah.
Okay. How is your sleep in general?
Usually okay.
Usually okay?
Yeah.
Okay, go ahead. This one we're going to put in the ankle. So let's see. If you, why don't you sit here, and people,
Okay.
if you want to see this happen, you have to actually get out of your chairs and come over
Should I
here.
take my shoe off?
You will have to just roll your pants leg up.
Okay.
I mean, actually, and it's on the right side or left side?
Right side.
The right side. Let me get your left ankle.
Okay.
She's like shaking.
It's really not that bad.
Okay.
I'll hold your hand if you need it.
Okay.
Okay. So here we are.
Video of it.
You just want a video of it?
Yeah.
Okay. All right. Any tenderness in here?
Right, like up a little bit more, yeah. That one.
Right there?
Mm-hmm.
So diagnostically speaking, we're actually using this as a diagnosis as well, but sometimes we'll also feel pulse, look at tongues. That tells us a little bit about what's going on with you. So here comes the first one. Is that okay?
Yeah.
It's in. I'm going to push a little deeper. Okay. Okay, what usually causes the pain in your back? Like twisting or moving, or what causes it?
Like twisting, I guess.
Okay, twist and tell me where you feel it right now. Same spot, or did it move?
I don't really feel it
It's gone?
anymore.
That's what I would expect. Okay.
Alright.
Anybody else have like an ache or pain or want to try it?
Y'all do it. It's fun.
Y'all do it. It's fun. You can Snapchat it. All right. What's your problem?
Shoulder.
Shoulder.
That was
Like
like-
shoulder in the here.
Shoulder back here.
Okay, this is actually a very similar spot. So if you want to go ahead and take 103. And oftentimes, how long has that been bothering you? Let me get your pants leg up. This right side.
2 years.
2 years? Result of an accident?
Result of a rugby injury.
Rugby injury. Okay. So in Chinese medicine, so if someone comes in with, say, like an injury like this, the acupuncture here, actually what we're doing is, this particular method is shutting off your brain's perception of pain. It's actually not getting to the problem, but it will help in terms of the healing process. Oftentimes, if someone were coming in with like an injury like that, I might put a needle directly into the spot. And we'd often use herbal compresses as well. And herbal compresses are like little patches with their adhesive. You stick them on, and then you get a benefit, like Salampus, actually. So here we are. I actually sprained my toe yesterday, so I'm wearing one on my foot, and that's why I'm moving slowly today. So where is it again? Kind of close to your neck?
It's down my neck and down to my shoulder.
Down to your shoulder. So that, we look at that as being the small intestine meridian, which I match with the liver. Anything tender through here when I'm pressing?
All of that.
All of that. Okay. This area actually also relates to like anger, mental emotional problems.
So angry.
I'm sorry. What is your name?
Alex.
Alex. See, I asked, and I will never remember what your names are. Remember, you're Alex. That's it. Nadia.
Yep.
I forgot your name.
Elise.
Okay. All right. Move your shoulder around. Tell me where it hurts.
Towards the outside.
Towards the outside. Let me take a
So towards this. it's kind of-
scapula area.
Yeah.
So like shoulder blade.
Yeah.
Okay. How about through here?
Right there.
All right. Try again. Down where it hurts. Cured? All right.
For now.
Not quite. It's not cured. So what we're
For
gonna do is
now.
we're gonna do another thing here. Tenderness in there at all?
Yeah.
Yeah. Oftentimes this relates to your neck. You have very tight muscle there.
Mm-hmm.
Do you get like shin splints or ankle? Yeah.
Do you have anything for shin splints?
Mm-hmm.
Because I have that right now.
One thing at a time.
Oh yeah, yeah, you guys.
So yeah, so diagnostically, if someone came in with this problem, this is one method we would do. We would just say, where's the pain? And we'll treat the pain. Sometimes, like I say, if it's been from an injury, we'll even look at X-rays or MRIs. For example, are you familiar with slip discs? Like if the disc, of course the rugby players heard of it. That's when the disc between your vertebrae slips out and it's pressing on a nerve, and you'll oftentimes feel pain going down your legs. And so then we will go and treat that local area, oftentimes using electrical acupuncture. And that's this machine that sends a light pulse through your through the needles to help loosen up the area. So a lot of things that we can do with acupuncture. Once again, herbal medicines, we might use a compress. Sometimes we'll even give an herbal formula as well, where once upon a time they give you like 15 different herbs and you'd boil it up and then drink it and it would taste horrible. Nowadays we can give it to you in a pill form or a capsule form or a powder form. So there are other ways of doing it. So it really depends on what someone's coming in for. I'd say it used to be about 25% of my practice was people trying to get pregnant. So we can use acupuncture to help balance out hormonal systems. So for example, people who get like premenstrual symptoms, menstrual cramps, those sort of things, acupuncture works pretty well. We use a lot for mental emotional problems like depression, anxiety, another big part of the practice. Digestive problems like IBS, Crohn's, colitis, all these things can be treated with Chinese medicine.
Fibromyalgia.
Fibromyalgia is a huge one. Are people familiar with fibromyalgia? Yeah, some of you are nodding. It's basically this thing where all these points in your body are really, really tender. One of my first successes when I was still a student intern was with a fibromyalgia patient. She walked in on a cane and she walked out on this. She's like, oh! So that gave me so much confidence back when I was your age. So, anybody have any other issues or a question? Uh-huh.
I saw you put the needle on his slanted, whereas this one's like straight down.
Yeah.
Is there a reason for that?
Yeah, because here, that's bone. Sorry, I just had to do that. That's bone. The needle wouldn't go directly into that. So I have to go between the skin and the bone. It's very thin. If you go ahead and just press like on the outside or the inside of your ankle right there, you'll notice it's bone. There's hardly any skin, and that's why we went at an angle.
It feels really weird if you like move.
Yeah, don't move.
Oh.
I mean, actually, it's not bad. It's fine. Actually, you're stimulating the needles, and I'll show you something pretty cool. This is when I first started doing acupuncture, I was apprenticing in Taiwan, and my teacher, she put a needle right here because I was having breathing issues. Like Taiwan air is horrible, and I was like having asthma, and so we went right into there, and she put it in. And usually with this one, you'll feel it tingling all the way into your hand because that's going right into what's called the median nerve. Now watch that. So I was doing that, and my teacher was like, "What are you doing?" But it was like, but yeah, if you move it, that sort of thing will happen.
Is that usually why people like lie down when this?
I mean, you don't have to lie down. I treat people sitting. I treat people lying on their back, lying on their side, lying face down, sometimes even standing. Like, for example, back pain, it's easier to treat someone when they're standing because we can find the spot better. Yeah. This is a sharps container, so you don't share bloodborne diseases.
Okay.
Anybody else want to try a needle? The concentration, focus? What do you have going on?
Shoulder or back.
Shoulder or back? Lower back or?
Lower back.
Lower back. Let's go get you in 107 here. Right over there. I'm just calling out the numbers of the chairs. I have no idea. I've actually done lectures in and it's good to leave them in for about 5, 10, like at least 5 minutes, ideally like 20, 30 minutes to get the whole benefit out of it.
Here?
Yeah. You don't pray for
What part of your back is bothering you?
All like around the lower back, mostly on
Lower
the left
back.
side.
Is this a result of an injury or just always been this way?
Injury.
Injury? Okay. Weightlifting injury?
Yeah.
So that's the other thing we do is we look at people and we can oftentimes tell from their body types like what kind of constitution they have. I mean, obviously he lifts weights, but then oftentimes when we see people who lift weights, it comes with a whole other issue, a lot of other issues because most people who lift weights don't stretch, and so they start getting imbalances, and so that comes up to other problems as well. So it's right across. Tenderness in here at all?
That first spot.
That first spot right there.
Yeah.
Okay. Actually, you can does it hurt more when you stand?
Yeah, but
Stand. If you want, you can see the needle a little closer. Stop wiggling the needles. All right, there we go. And go ahead and move around and tell me where your back hurts right now.
a little bit more on the left side. Like
Just shift
down
it to the
leg.
left?
Yeah.
Down the leg?
A little bit down like the back side.
Oh, down the back side. Okay, on the left. So tenderness in there.
No, not really.
How about out to here?
Yeah, right there.
Do you have sleep issues?
Yeah.
Okay, try moving around again. Where does it hurt right now?
Nowhere.
Okay. So in this case, when I press there, and you can just relax your arm, I press in that spot. This relates to the heart meridian, and so I use the heart meridian because it balances where he was pointing. That's the gallbladder meridian, and we say the heart and gallbladder meridian balance each other out. But when I press in that spot and he has tenderness, it also tells me he might have sleep problems as well. Oftentimes trouble. That particular area, it's oftentimes trouble falling asleep, busy brain, lots of vibrant dreams. Is that you, or are you more of a wake up in the middle of the night type person?
More of like stay up till like 6 in the morning.
Playing video games, not because you.
No, not even playing like video games or anything.
Just like you can't fall asleep, you're lying in bed,
Yeah.
can't fall asleep, brain thinking a lot.
Yeah.
Yeah. So that's oftentimes that's diagnostically what we look at. The other thing we'll do is like look at tongues. We can play a game here. I might make a fool of myself, but if anyone wants to show me their tongue, I can try to figure out things about your health. Anybody?
Anyone?
Anybody want to show me your tongue? It's kind of cool in terms of just
Professor
knowing
Gao.
what people we look for in tongues. Yeah, okay, it looks like. Okay, let's turn around and so we can. Now, see her tongue is very pale on the side. Like turn your tongue this way. And it's kind of pale on the side, but it has a very red tip. Okay, so you can go ahead and close your mouth. So usually, we won't talk about too personal of issues, but usually if we see like the pale sides on the side, we think of this as people who have trouble staying asleep, not falling asleep, but staying asleep. Oftentimes tight shoulder, tight neck. The tip of your tongue is red, which is oftentimes a sign of like having vivid dreams or even nightmares. Does that fit you at all? Any of it?
Recently, yes.
Uh-huh.
Yeah, that's true. I
Mhm.
think these 3 days I get a nightmare. Yeah,
Nightmare,
dreams.
mhm.
Yeah.
还有月经普通吗？
我刚那个流产了，
刚流产啊，
所以我现在这流产不到1个月。
难怪，因为你的舌头。OK。
呀呀呀呀！
Okay. So yeah, her tongue, the reason for her tongue, looking at it is a very good reason, but I won't, that's her medical history, I'm not going to share it with you. She's insane. Homicidal mania. You better run. No, I'm sorry. But anyway, yeah, but her tongue fits the total constitution.
CCFCCP.
Say what?
CCFCCP.
I have no idea what that is.
It's a derogatory medical terminology.
Oh, okay.
That's slang for cuckoo for Cocoa Puffs.
Cuckoo for Cocoa Puffs. Yeah, okay. Anybody else want to show their tongue? Let me guess what's going on. All right.
Mine on his face is
All right. If your tongue is special, I'll have them look. So your tongue as a whole is very pale. Like your professor, she was very pale on the side, but your entire tongue is pale. And so that's, and let me see it one more time. Stick it way out from you. Yeah. So it's very pale tongue, and we usually relate this to someone who has generally low energy.
Oh, wow.
I don't know. Is that, were you a low energy
Yeah.
person? Yeah. Generally low energy. Personally, we would say, light periods are probably typical. You don't have to share that with everybody. Tight shoulder, tight neck. Poor digestion, gas, bloating, we would expect. Are these things accurate?
No, yeah, I have digestive issues.
Yeah,
so
it's pretty
that's
accurate.
true.
So usually when we see this, we would give her herbal medicine and also acupuncture. We would probably do some along the stomach to help improve her digestive system. Yeah. Anybody have any other questions about what we do or how we do it?
Good. I'll go.
And if you want, if you're not scared, I can do one on the very top of your head. This will help your concentration and focus.
Me.
I can tell the blonde.
It's probably your go-to joke. And
Well, I don't think any fell.
I hope not. No, it's not. Thank you. We fine.
We don't think
So for concentration and focus, I'm only going to do one, but technically there are five points we use. They're called the 4 intelligent points, plus the very top one here. So basically just pop it in. That's it. That's probably the what you call it, the tube.
Does it hurt?
I didn't really feel it.
You didn't feel it at all. I don't know if you didn't feel it at all. Well, yeah.
Do you feel smarter now?
So,
Yeah, I feel so much smarter.
anybody else want to try it? Did you have you were about to ask something?
Yeah, I have a question. So, with the body, I see how like the 5 phases, kind of, is that similar with the tongue? Are there like places on the tongue that kind of like, does that correlate in any way?
So
or to the
not
yin and yang?
the phases, but to organs. So if we took a tongue and do that, we think of the sides as relating to the liver. The tip is relating to the heart. The center the center here to the stomach. This area to the lungs. This area to the kidneys. So each part of it. That's horrible. Each part of it looks like each part of the tongue relates to certain parts of the body.
Okay.
Now some people also have like a coating. We look at the shape of the tongue. So some people have ridges. Does anyone have ridges in their tongue? They look in the mirror and they have little ridges on the side of their tongue. You or your daughter, do you have ridges? Are you willing to show your tongue? No. Okay. Anybody who knows they have ridges on the side of the tongue and willing to share their
Like
tongue?
where on this side of the tongue?
So the tongue will kind of look a little like this. I'm exaggerating. That's some.
Let me see.
Never mind. You guys have dirty minds.
It's almost like wrinkles on the side of the
It's
tongue.
not. Let me see your tongue.
I don't have it.
I don't have a tongue.
I don't
All right. Okay. Oh, you do have them.
Oh, awesome.
Are you okay sharing
Yeah,
your
I
tongue?
mean,
All
yeah.
right. Stick it out. So here, look, and hers aren't very defined, but do you see the little ridges right there? And that's usually a sign. That's you don't see them. You might have to get a little closer and look. I saw it more on her right side than left. But that's because, from a Chinese medicine point of view, we say it relates to spleen deficiency. And when we say spleen deficiency, we think of that as related to digestion. Your body is essentially retaining fluid, so it's expanding. Can't take her anywhere. And it presses up against the side of your teeth, which creates those ridges. But when we see that, we automatically know there's probably something going on with her. And that sounds bad. We know what's going on.
I think I'll leave.
Yeah. Yeah. Anybody have?
How is the education of acupuncture, Chinese medicine, like how does that overlap?
How does one become? Oh.
Mm-hmm. Yeah, how does that overlap with the ordinary school system?
Like tradition.
So do you mean like going to medical school or just college?
Yeah.
College dash.
Yeah.
So it depends. Like in the United States, you basically, actually you no longer need a bachelor's degree, but at one time you needed a bachelor's degree, and then it would technically be a master's degree. You would go to get a master's degree in Chinese medicine. It's about it's a 4-year course that's compressed into 3 years, and you go year round. And basically, it's you learn, number one, Western. You have to learn Western medicine. So we learn about physiology, anatomy, the digestive system, the circulatory system. We learn all of that in depth, as well as the pharmacology. So, for example, the kinds of drugs that are used for certain issues from a Western perspective. At the same time, we're learning about acupuncture points, the meridians that connect the acupuncture points, the individual herbs, how to combine those herbs. And after you have about 1.5 years of this under your belt, then you start seeing patients under the supervision of a supervisor. So, for example, someone will come in, we'll look at your tongue, feel your pulse, then we will give you acupuncture. And when you first start, you suck. I mean, that's just normal. I mean, your patients are going to be screaming. But usually what happens is that these schools offer really cheap acupuncture. So there are people who are willing to go in and get like acupuncture for $10 to $15. And so they go in and get worked on by students. And so after that, the longer you do it, the better you get at it. And usually it takes 3 to 4 years. And after that, you have to take a licensing exam. Every state has different rules, but generally speaking, most of them take a national board exam. And then after you pass the national board exam, then you have to apply for your individual states. Now, some states have their own exam, like California has its own exam, and it's a harder, more stringent one. Yeah. My route, I was living in Taiwan, and my father had always wanted me to be a doctor, of course, because he's Chinese. My uncle, actually, he was a Chinese medicine doctor. He was what's called integrative medicine. China is a different story. When you go to become an acupuncturist in China, you essentially go to medical school, but instead of specializing in a specific thing like cardiology, you'll specialize in Chinese medicine. So you have to learn both Western medicine and Chinese medicine. Well, my uncle, he was a Western medical doctor, but when the communists took over, they forced him to learn Chinese medicine. And then after he did that, he actually realized it worked for a lot of things. And so he ended up doing what's called integrated medicine, which is something very common in China, where they use both Western medicine and Chinese medicine together. So if someone has like a gynecological issue, they might give you herbs, or they might give you like a drug based upon what type of issue you have. Or sometimes they'll use a combination of drugs and herbs, or sometimes they'll use acupuncture and drugs. So they'll do they've done a lot of research in China with regard to that. Now, my uncle, when he retired, he came and lived with us. And I grew up actually right across the street here, and my uncle was treating patients inside of our house, and so that was my first exposure to Chinese medicine. I was able to watch him treat people, and we use what's called moxibustion, which is using this heat over acupuncture points, and it smells a little bit like marijuana. And I remember the first time I walked in and he was using it on somebody, I was like, oh my God, he's smoking dope. But it turned out to be moxibustion. So anyway, that was my first exposure. But then later when I was living in Taiwan, I was learning a martial art at the time. And one of my Kung Fu brothers, he was also learning acupuncture from a master. And my father had just said, oh, why don't you do acupuncture while you're in Taiwan instead of wasting all your time doing XXX. So I went to do this more to tell him that I went there, saw it, wasn't interested. But actually the first time I saw it, I saw my teacher do these amazing things. Like, wow. And so that really was what got me into it. Because I came from a liberal arts background myself. I did not start anything medical to begin with. So my 14-year-old self would think my current self was a total loser. Anybody else want to get a needle for their concentration focus or something else? Okay. And if you want a needle, go sit in that line here from whatever the second row is.
Can I take this one out?
Yeah, do you not like it?
I'm afraid I'm gonna touch it or something. Like, forget about it. I don't know.
Anyone who wants to come here or go in the whatever row and we'll add them in. Is that okay?
Yeah.
Does anyone have any other questions? Yeah, you can do it that way too.
Oh my God.
Tons of needles.
When they were doing it when I initially got my shoulder injury, it was like all the way up to my knee and then down my arm. It was.
Did you want it or? Yeah. Oh, okay. I knew you were sitting in this chair and you didn't. I thought you were about to abandon it. So when I said first row.
Huge difference though. So.
Duke.
PA school.
Ah, very cool.
It's my dream.
Duke. So this is for anybody. Did you guys want it too or? No. Okay. Sure.
It's literally the funniest thing I've ever seen. Everyone just has a sneaking.
Okay.
Yeah.
Anybody else want one who is not in that row?
Yeah, screw it.
It's hard to see the needles. I'll also take one.
Well, the thing is that because we do what's called balance method, I really can't do the top of your head.
Does it hurt?
I know.
Did it hurt? Anybody going to the top of your head?
Did you feel it?
No.
Not really.
Okay.
Yeah, this. Like I was telling you,
Kind of want
when-
to try, but
Why not?
all right, there we
when
go.
when
Mind
I
you,
go
everyone who got a
lying
needle has to
down,
pay me $10.
It goes,
No, I'm just
they
kidding.
go up to my knee,
I'm scared.
and then they
I'm
go
gonna come from
from
behind you
here
'cause-
down my back,
I'm so
all the way
scared.
down.
Are you?
I look like a pig.
What is it?
So-
But it feels.
Oftentimes-
like they'll just
Is it in?
hold it.
Wait, were you the one who wanted the needle? You were the one who wanted the needle, not you.
No,
Right?
no, no.
Okay, just making sure. It's in.
It's in?
No, it's not.
Different
So,
stuff.
now it's in.
Oh.
That wasn't that bad, right?
No.
Like little tunnel tubies.
I can feel it though.
There's a slight prick. But usually, if you feel it, it's a slight prick. Everyone's trying to selfie themselves.
Yeah.
Does anyone have any other questions about Chinese medicine?
Are the needles always this thin and small, or do they vary in size?
So they vary in size. We actually, the longest needle we have in our clinic is about that long. We will put it into people's butt for something like sciatica. The thing being is that you will feel that less than what I feel put in your arm. It's a little bit thicker, not that much thicker, but it's longer and a little bit thicker because you need a little more tension. But oftentimes we'll use it, for sciatica or or a deep hip muscle pain. You will barely feel it at all because it's going through fat. Yeah.
Awesome.
And I also heard like there's one type of needle that like let out the
Blood.
pressure.
So a bleeding needle. So bleeding is a technique in Chinese medicine. I actually don't do it because I'm like, blood. That's like HIV and so, but basically you can bleed, like sometimes you'll see you have a really big vein that's all purple and nasty looking. Sometimes we'll bleed it depending on where it is. So for example, if someone has hemorrhoids, we'll bleed one in the back of their knee. People who have like fevers, we will bleed a spot right here on their fingertip, and this one hurts like all hell. All heck. And so it will work. Bleeding does work. Oh, skin conditions, we'll use bleeding as well. Another method we use is called cupping, which we take this glass cup, put flame in it, so it takes out all the oxygen, put it on the back or some other part of the body, it sucks your skin right up. And so we'll oftentimes use that for people who have colds or skin conditions. Any other questions? We have 5 minutes before I gotta get out of here.
I'm not sure how to say it in English, but like there's something like you know how people say 上火.
上火,
Can you explain that a little bit?
Okay, so 上火 literally means rising fire, right? The 上海的上火 just yeah. So basically, it's people like their face will turn red, they get angry. Oftentimes, it comes from eating spicy or greasy foods. So we think of it in terms of we describe it as being heat rising to the head or fire rising to the head, and that's actually something very common we see in our society. That's when we talk about that fire being to excess. Any other questions?
Do you get acupuncture done on yourself?
All the time.
By other people, or do you do it yourself?
Both. It's
Okay.
better to get other people to do it, but like for example, I sprained my toe yesterday and I was just sticking myself with that because I wasn't
Nice.
near any of mine. No, it actually hurt. It wasn't nice. It kind of sucks. But it is nice to have the skill. Yeah. So yeah, I get acupuncture done on me as much as I can. It's great stuff. Usually, if you get a full-blown treatment, you will feel so relaxed after, or happy. I'm gonna take you guys out.
Does it
Look at
relieve pressure when you get the full body treatment?
Uh,
Because I heard that like part
what do
of
you
the
mean
reason.
pressure? What do you mean by pressure?
I heard that part of the reason, like, I know the needles are hitting pressure points, but like I heard that they also help to relieve like pressure in your body.
Relieve pressure. So when you say because you're a physician, you want to be a physician's assistant. I don't know
yeah,
if you
I mean,
actually
I'm not one, but
I don't know if you mean literal pressure in your body or if it's like kind of stress. If you mean
stress.
yeah, it totally helps with stress. When the needle has been in for 20 minutes, your brain is going to start kicking out endorphins. It's going to make you feel better. Yeah. Any other questions?
How much would a full body treatment usually cost?
So if you were going to my West End clinic, then that would be usually the first time someone comes in is 110 and a follow-up is 85. Keith Bell, he's probably the biggest acupuncturist in Richmond. I think he charges like 180 for a first time, 120 for follow-ups. So it varies. There's also like a community clinic. Pamela Howard, she's over Hamilton Street, kind of broad in Hamilton. She does what's called community clinic, which is kind of like now where you have a lot of people getting acupuncture at one time and there's no privacy whatsoever. But in hers is a sliding scale. I actually have I have a place over on Cary Street. That's my martial arts school. It's like maybe 10 blocks from here, and 2 mornings a week I'll do community clinic. So you get no privacy, but you can do acupuncture for like $15 if you want. So you need help for those exams. Yeah. Any other questions? If not, then I guess we'll call it. And otherwise, I'm supposed to see you next week. I'll teach you some Kung Fu.